Piles, also known as hemorrhoids, are swollen veins in the lower rectum or anus. Here's some essential information. Types of piles. 1. Internal piles. Located inside the rectum, internal piles are usually painless and may bleed. 2. External piles. Located outside the anus, external piles can be painful and may itch or bleed. 3. Prolapsed piles. Internal piles that protrude outside the anus. 4. Thrombosed piles. External piles that develop a blood clot, causing severe pain. Causes. 1. Constipation. Straining during bowel movements can cause piles. 2. Diarrhea. Frequent diarrhea can cause irritation and swelling. 3. Poor diet. Low-fiber diet, spicy foods, and excessive caffeine can contribute. 4. Lack of exercise. Sedentary lifestyle can lead to poor circulation and increased pressure. 5. Pregnancy. Hormonal changes and increased pressure on veins can cause piles. Symptoms. 1. Bleeding. Bright red blood during bowel movements. 2. Pain. Pain or discomfort during bowel movements or when sitting. 3. Itching. Itching or irritation around the anus. 4. Swelling. Visible swelling or lumps around the anus. 5. Discharge. Mucus or pus discharge from the anus. Treatment. 1. Lifestyle changes. Increase fiber intake, exercise regularly, and practice good bowel habits. 2. Over-the-counter medications. Creams, ointments, or suppositories to reduce pain and inflammation. 3. Prescription medications. Medications to reduce pain, inflammation, or bleeding. 4. Surgical procedures. Rubber band ligation, sclerotherapy, or hemorrhoidectomy. Prevention. 1. Eat a high-fiber diet. Include fruits, vegetables, whole grains, and legumes. 2. Stay hydrated. Drink plenty of water to prevent constipation. 3. Exercise regularly. Regular physical activity improves circulation and reduces pressure. 4. Avoid straining. Avoid straining during bowel movements or heavy lifting. 5. Manage stress. Practice stress-reducing techniques like meditation or deep breathing. When to seek medical attention. 1. Severe pain. Severe pain or discomfort that interferes with daily activities. 2. Heavy bleeding. Heavy bleeding or bleeding that lasts for more than a week. 3. Fever. Fever or chills accompanied by piles symptoms. 4. Difficulty passing stool. Difficulty passing stool or experiencing bowel obstruction. 5. Persistent symptoms. Symptoms that persist or worsen despite self-care measures. A well-balanced diet can help alleviate piles symptoms and prevent their recurrence. Here are some dietary recommendations. Foods to include. 1. High-fiber foods. Include foods rich in fiber like fruits, berries, apples, bananas. Vegetables. Broccoli, carrots, leafy greens. Whole grains. Brown rice, quinoa, whole wheat bread. Legumes. Lentils, chickpeas, black beans. 2. Fluid-rich foods. Include foods with high water content like watermelon, cucumbers, celery. 3. Omega-3 rich foods. Include foods rich in omega-3 fatty acids like fatty fish, salmon, tuna, mackerel. Nuts and seeds. Flax seeds, chia seeds, walnuts. 4. Probiotic rich foods. Include foods rich in probiotics like yogurt, kefir, sauerkraut, kimchi. Foods to avoid. 1. Low-fiber foods. Avoid foods low in fiber like processed meats, refined grains, fried foods. 2. Spicy foods. Avoid spicy foods that can irritate the digestive system and worsen piles symptoms. 3. Dairy products. Avoid or limit dairy products, especially if you're lactose intolerant, as they can exacerbate piles symptoms. 4. Caffeine and alcohol. Limit or avoid caffeine and alcohol, as they can dehydrate the body and worsen constipation. Beverages. 1. Drink plenty of water. Aim for at least 8 to 10 glasses of water per day. 2. Herbal teas. Drink herbal teas like peppermint, chamomile, or ginger to help soothe the digestive system. Meal frequency and timing. 1. Eat small, frequent meals. Divide your daily food intake into 4 to 6 small meals to ease digestion. 2. Avoid heavy meals. Avoid eating heavy meals, especially before bedtime, to prevent discomfort and worsening piles symptoms.